Hello, this is Sveta Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we have yet another startup entrepreneur with us, Ashfaq Ashraf. Ashfaq is a co founder of Bagmo Pvt Ltd. And what is Bagmo about? So, Bagmo started with this aim to eradicate the very important problem of the rural population, that is non-availability of blood in rural parts of India, by focusing also on the maternal and child healthcare. Welcome, Ashwak, to Medicircle Healthcare Startup Series.
Hi, thank you for the opportunity. And I am Ashfaq from Bagmo Private Limited. I'm the co-founder of this company. Over to you.
Great to know about you. And first, understand how big the problem is, Ashwak. So, as per a study, estimated a national demand of around 14 to 6 million whole blood cells, which translates to around 36.3 donations per 1,000 eligible persons everywhere. Currently in India, we have around 2,760 blood banks, of which 1,131 blood banks are supported by NOCO, Ministry of Health and Family Welfare. But blood availability is still a problem in the villages, especially in the rural areas, because sometimes the needy patients in these villages and the rural areas don't get blood. Sometimes it takes around 4 hours for them to get that needed blood, and that can save a life. So we'll be discussing on that. Moving on to my first question, Ashwak. So you have started Bagmo Private Limited. So let us know what is the startup about and what real problem it is solving.
Okay, so the problem availability of blood, people are knowing the availability is very issue, and blood is the only thing that can save lives in the emergency conditions, especially in the accident cases or maternal delivery cases. In this kind of scenario, blood is very much required, and especially for a country like India, where anemic patients are very high, so they also require immediate transfusion whenever some surgery or delivery is happening. So this is very important. And in the current scenario, around there is a huge shortage of voluntary donation is there. Even though the government is saying we are going forward with 70% voluntary donation, but the actual scenario currently it's happening forced replacement family donation is happening, and we have to eradicate. And country like India, in a bigger country, we are currently having nearly 3,000 blood banks. Is that sufficient for making blood available to every places? The government initiated the storage facility in many rural area and many smaller hospital, primary health cares and secondary level health cares. But how are they working? Are they able to make sufficient inventory for their patients? That's what we are addressing with our solution. And the main pain point we are addressing is that make sure the healthcare facilities are having adequate blood stock in a safe and a quality manner.
Sure. Rural areas also hardly have these blood banks, which is very much
Yes, yes.
to ensure that the patients are getting blood in the times of emergency. If we go to the stats, like requirement for a blood bank is it requires approximately 1 crore for equipment, also an uninterrupted power supply, which becomes an issue sometimes in these rural areas. Also, rooms with adequate area technicians who are trained on all such things. So whenever the blood is needed, it is not exactly it is from a nearby blood bank, which is wherever it is coming, because there are no blood banks in the villages. Far from villages, there are some, and it is actually the deficit in the entire nation is approximately of 20%. So in such a scenario, what are the prime factors or the USPs that you aim to bridge this unequal gaps?
So one major thing is that the inventory is low. At the same time, the precious blood is getting wasted as well. So we want to avoid all these wastage, and whenever, especially in remote areas, the wastage should be. So one of the major advantage USP we are offering is that have a close monitoring of inventory and reduce any wastage, and which will ensure that quality always individual blood bags quality we can ensure using our end-to-end tracking system, and that will help build the confidence in storing enough amount of blood and make sure that whatever the blood getting to reaching to the patient is always safe. This is one of the major advantage. And another thing we can note that in the current scenario, facility wise or infrastructure wise or the electricity wise, this things are already available. And when you say about rural area, it's not like very much vulnerable places. It's like any tier 3, tier 4, or tier 2 cities are also currently facing the shortage of blood. And many of us over here hearing us also faced that some patients or some relatives get admitted. We have to rely on WhatsApp, our friend circle, immediately require O positive units. And these are the current scenario. This should be avoided. That's our vision. And we can, this is one of the USP we are offering, that always make sure that sufficient amount of safe blood available.
Definitely. So you, when you started, as you're based out of Kerala, so when you started and how many lives you have touched so far?
Yeah, so we touched 5 years back after a fellowship in maternal health, and I was working in as a innovation fellow in Odisha. That time we started in one of the incident in 2015 January. We heard that in hospital in Kesinka district, they have all the facilities. They have facility, power, refrigerator, anesthetist, gynecologist. But two women died in 1 month after a delivery. And scenario is like only the blood is not available there. You just make blood available. That's all it is needed. And it's a supply chain scenario. And we wanted to start working on that. And luckily, we got a government grant.
So yeah, so that is what I asked. So like, as you have also raised fundings from Brink, so how much funds you have raised so far, and how has the funds been utilized?
So, majorly in the initial stages, we utilized mainly for the product development and reaching to the government locations, especially in the rural areas. And recently, we started marketing activities and started spending in the marketing areas as well. Till now, we have raised majorly fund as a grant, and majorly from BIRAC, a Government of India Council. And other than that, we also raised equity-based grants from programs like Brink and IIITMK, Derby Association Bangalore, and C Camp Bangalore. These are the some of the equity-based funds we have raised. We also one of the shortlisted startups in Qualcomm Design Innovation Challenge, and so we have raised nearly 1.5 crore as a grant and equity-based fundings. And till now, we have touched more than 80,000 families using our solution, and it's been in currently in using in more than 10 remote rural areas and around five main blood banks. And so we have monitored more than 45,000 units of blood bags as well.
So as we talk about the vision, mission, and the people you have served so far, let's talk about the financial figures also. So what were your revenues in FY 2022, and also what you're planning to close, especially in FY 2023? Serving rural places, it's actually lot of funds is required. So are you able to generate those kind of funds?
Yeah, yeah. So basically, we are targeting to break even the company expense by financial year 23, and be export ready the product for many other developing countries, as well as LMIC, low and middle income countries. We are targeting the coming year. And so the problem we are addressing is a large unmet need, and we will be able to sustain by selling the product and making sure the services, the software as a service to the hospitals or healthcare facilities.
Sure. So, one quick question there. You might have faced a lot of challenges in this journey and have tried to overcome most of them. So, what are now your future goal and future expansion plans, especially in the terms of reaching out to more and more rural population of India?
Okay, yeah. So one of the vision we are seeing is that in the coming near future is blood should be available like any other medical product. When some patients are required, the bystander can go to the blood bank and get the blood after giving the paper. They don't need to just start searching or calling the friends for a replacement donation. So this is the vision, and we are working towards that. And make sure always safe blood available in every places in India, and that's one of that's the vision we are seeing in the coming future, and we are working towards that. We are getting collaborated with many state health agencies and other NGO partners for achieving this goal.
That's good. I would like to share one more study, Ashwak, there. Like, as the maternal mortality rate of India has declined by 10 points, as per a special bulletin that was released by the Registrar General of India. So now it has declined from 113 in 2016-18 to 103 in 2017-19. That's a decline of 8.8%. So, but when we talk
Mhm.
about maternal mortality rate, which accounts to approximately 75% of all the maternal deaths. There are some major complications. Some of them are exactly like severe bleeding, infections, high blood pressure, and other things. So, what is the topmost reason is severe bleeding, mostly bleeding after childbirth. That is one of the most major complications that accounts for approximately 75% of the maternal deaths. So, in such a scenario, we definitely need to have more and more blood banks and an access to safe blood and blood products, especially in the rural areas, so that we are able to decrease this MMR rate by lot more points. That is the vision, and I think Ashwak's Bagmo is also working towards the same vision. Thank you so much, Ashwak, for joining us today. One last word would we would like to hear from you during this journey. You might have, as I said, you might have faced a lot of challenges. So any learning you would like to share with our fellow entrepreneurs here at Medicircle?
Yeah, means no normal people do startups, as everyone know that.
That's the
Yeah.
best thing I have heard. Yes, it's very true. So you have to be really, I mean, something in your mind that keeps you on point, because otherwise there are so many
Yeah.
factors that deter you from your aims. Over to you, Ashwak.
So yeah, so basically every founders will be eager to solve something in the society, and they come forward for the solving such a problem. And when that they gather the team, they sell the idea, they get the funding. And what I did the initial stages itself, that we kept milestones. We do step by step, like every step is a success. And even though some startups fail, but never the founders.
Yes.
Means as yeah, people say that they will be always successful. I still believe that the moment you try to start up something or do the entrepreneurship, you are successful, despite whether you get the funding or whether you reached more than 3 years, but you are successful. So
That's some golden words from Ashwak, Ashraf. Startups may fail, but entrepreneurs will never fail because they are still trying to succeed over their failures with their perseverance, with their vision, with their determination. I think many such startups
exactly.
are changing the scenarios, especially in the rural healthcare sectors of India. Thank you so much, Ashwak, for joining us today at Medicircle. We wish you and Bagmo all the best so that it can serve more and more rural people out there with such an important cause, with such a noble cause. Because, see, as WHO also estimates that the blood donation by at least 1% of the population is generally the minimum to meet the entire nation's most basic needs for blood. And if I talk about India,
Exactly.
as per the data of 2016-2017, India has a shortfall of just 1.9 million units or I may say 15% as per the WHO norms. So hope this is also filled up and this gap is bridged and we are able to get enough blood for all the needy patients to save a life. Thanks, Ashok, for joining. All the best for your future endeavors.
Thank you for the opportunity.